Hello everyone. Today's presentation is about the Parkinson's disease. This presentation is divided into six parts. I will start talking about a part related to the Parkinson's disease introduction. Then we will discuss the symptoms, diagnosis, and causes of Parkinson's disease to be followed by a part related to the brain structural and implicated functional changes, and we will end the presentation talking about the Parkinson's disease treatment. First of all, Parkinson's disease is the second most common neurodegenerative disorder, affecting 2 to 3% of the population aged 65 years and older. Here in this graph, you can see the global prevalence of Parkinson's disease by age and sex in 2016. We can notice that the prevalence of Parkinson's disease peaks at 85 years old. Um, from a neuropathological point of view, Parkinson's disease is characterized by the loss of neurons at the level of the substantia nigra, which is present here in the black area where I'm showing you. This loss leads to the depletion of dopamine at the level of the brain. Moreover, a key hallmark of Parkinson's disease is the accumulation of the alpha synuclein protein, which is shown here. Here you can see how the alpha synuclein protein is accumulated and aggregated in the neurons of the substantia nigra in this area here. That will lead to their death and then to the dopamine depletion. Regarding the symptoms and diagnosis now, the symptoms are classified into two parts, the motor symptoms and the non-motor symptoms. The motor symptoms include tremors, slowed movement, muscle stiffness, and balance difficulties. However, the non-motor symptoms are the non-motor symptoms include cognitive impairments, depression and anxiety, disturbances, autonomic dysfunction, loss of smell, sense, and fatigue. Now regarding the diagnosis, there is no there is no definitive test for Parkinson's disease. So diagnosis is based on the clinical evaluation and neurological examination. So doctors can assess the patient's symptoms, progression, and medical history, or doctors can do neurological examination to evaluate motor symptoms like tremors, rigidity, and gait abnormalities. Also, doctors can give the probable patient's dopaminergic medication to check if there is any improvement at the level of the symptoms. So in this case, we can say that the probable symptoms are really affected by Parkinson's disease. Also, doctors can perform imaging tests like the TATE scan imaging to determine the level of dopamine at the level of the brain. Here you can see the results uh, are are normal because the quantity of here you can see the normal quantity of dopamine level secreted, which is normal in the brain. But here you can see that the level of the dopamine secreted in patients suffering from Parkinson's disease is low or depleted. So we can check them from the colors obtained here. Now, regarding the Parkinson's disease causes, the causes of Parkinson's disease can vary from genetic factors to environmental factors and also to bacterial or viral factors. So, regarding the genetic factors, we can discuss three mutations that are essential to have or leading to Parkinson's disease. So, we can see the SNCA mutations. So this kind of mutations, when it's present and the allele is muted, present in the triplet form or doublet form, this doublet or triplet form leads to more expression of the alpha synuclein protein, leading to more aggregation of the alpha synuclein protein and ultimately leading to neurodegeneration. The leucine rich repeat kinase 2 mutations كمان can lead to Parkinson's disease. Why? Because this gene is essential for mitochondrial يعني activities and يعني يعني these kinases يعني when they are muted in, okay يعني when the glycine is replaced by serine, so its activity is increased, okay, and leading to what? Leading to mitochondrial dysfunction and impaired autophagy. And these events these happened events lead to can lead to Parkinson's disease. And also the PTAN induced kinase mutations can also reduce to can also lead to Parkinson's disease. Why? Because the PTAN induced kinases are important for the elimination and ubiquitination يعني للبروتينز والactivity of we can say that إنه البيتان induced kinases are essential for the mitophagy. So this kind of mutation prevents the mitophagy. So reactive oxygen species elimination uh, يعني sorry, the reactive oxygen species increases and the energy production decreases, and in this case we will obtain the loss of neurons in the substantia nigra. Regarding the environmental factors, we can discuss the pesticides and herbicides that are used in the agriculture. um, so these chemicals can inhibit the degradation of the protein, the misfolded protein, or also they can prevent the by يعني by their toxin the conversion of dopal into dopac, and the accumulation of dopal leads to cell death. So because of that we should control our يعني pesticides and herbicides should be controlled in agriculture. Here in this table you can see the different viruses and bacteria that can lead to Parkinson's disease. Okay, and here you can read about the articles. Now regarding the brain structural changes, the neural loss and Lewy body accumulation in the substantia nigra leads to dopamine depletion and motor dysfunction. However, the striatal atrophy in the basal ganglia uh, causes impaired movement control. Moreover, the gray matter atrophy in the motor cortex and thalamus slows motor response and reduces coordination. The volume reduction of the prefrontal cortex shows cognitive impairment. Additionally, the neural loss in the limbic system leads to memory decline and emotional instability. Finally, the loss of neurons in the pons and medulla oblongata and the serum can lead to autonomic dysfunction and sleep issues. Now, regarding the implicated functional changes, the dysfunction in the basal ganglia pathways affects the motor function, leading to tremors, bradykinesia, and rigidity. Also, the reduced prefrontal and thalamic activity affects the cognitive function, causing memory loss and attention deficits. Additionally, the limbic system dysfunction affects the emotional regulation. How? By causing depression and anxiety and apathy, etc. No? Now, regarding the Parkinson's disease treatment, actually, there is no cure for Parkinson's disease. Treatments focus on managing symptoms and improve life quality. Unfortunately, يعني treatments face several challenges. As we said, there is no cure. Treatments only manage symptoms. Levodopa related motor complications, fluctuating drug effectiveness over time, non-motor symptoms remain difficult to manage, side effects of medication, difficulty in early diagnosis, high treatment cost, and individual response variability. The treatment can work on three يعني points or domains. The treatment can improve or act as neuroprotector to protect the dopaminergic neurons from degradation, or the treatment can act as gene therapy to deliver genes to neurons to enhance dopamine production or protect them. Also, the treatment can act as deep brain stimulation, which is like the case of a surgery used electrodes to improve neural activity. Here you can see some researches that are related to the Parkinson's disease. So this research acts on the calcium channel modulation because the calcium imbalance because calcium imbalances may contribute to Parkinson's disease. So calcium channel blockers may protect dopamine neurons, and the research are still ongoing. Other researchers are working on the effect of Parkin protein and sporadic Parkinson's disease. So the Parkin protein usually neuroprotective is inactive in the sporadic Parkinson's disease cases. So researchers aim to boost Parkinson's disease, Parkinson's activity. Some researchers are working on the stem cell therapy, but unfortunately, the embryonic stem cells, after embryonic cell replacement trials failed, but the induced pluripotent stem cells derived dopamine neurons may offer a future for the therapy for Parkinson's disease. So researchers are still in the developmental stages. And finally, some researchers are working on to study the effect of the immune system because the immune system may contribute to PD progression, like the sargramostim, which stimulates the white blood cell production, which is being tested, and the clinical studies are ongoing, still ongoing. Yeah. Another treatment can be used, which is the levodopa. So here you can see the conversion of the dopamine precursor into dopamine. So this treatment gives patients a drug containing the precursor of dopamine. So here you can see how the bioavailability is affected or reduced for this drug therapy. So the bioavailability is reduced to the absorption of at the level of the small intestine, or also due to its dissolution, or due to its metabolism, that the drug can be metabolized in at the level of the gut, or can interact with plasma proteins, or can be eliminated or metabolized by the first pass metabolism, excreted in the kidneys, stored in the muscles, or in adipocytes. But alhamdulillah, this drug can cross the blood-brain barrier to reach the dopaminergic cells or neurons, but still the quantity reached these dopaminergic neurons is with small quantity. Here you can see the Produadipa, which is given for for patients in the advanced stages of Parkinson's disease. Here you can see a device which is connected by a tube to the patient's gut to release continuously the precursor of dopamine. Um, and this يعني offers يعني facility او to reduce the symptoms يعني او to change the patients into normal يعني approximately normal people يعني بيخففوا الموفمنت للايدين والlegs والarms. So now regarding the gene therapy, patients can be given pro7 genes that encode for key enzymes like the AADC, GCH1, TH, because these enzymes are essential for the dopamine synthesis. These genes are delivered through lentiviral vector. So the clinical outcomes shows safe and well tolerated, no detectable antibodies response against any of the Pro7 gene products. Also, there was an improvement in motor behavior in all the treated patients, and 11 of the patients had a reduction in the daily levodopa administration at 6 and 12 months. Here you can see the lentiviral vector used. Here you can see the added uh, genes اللي هن pro7 gene مثلا. For example, here you can see how it's modified to reduce the inflammation, to reduce the immunogenicity, to enhance the specificity, and this virus can cross the blood-brain barrier. Here we have another gene therapy. You can see the gene encoded is NRTN, to code for neurotrin, which is a neurotrophic factor that plays a significant role in the survival and maintenance of neurons, particularly the dopaminergic neurons, which are affected in Parkinson's disease. This gene is delivered through the adeno-associated virus, يعني of the second generation, and the clinical outcome shows no serious adverse events were reported, suggesting good tolerability of the procedure, no increase in the adeno-associated virus antibody or detectable NRTN antibodies. كتير منيح till now, but unfortunately 2 years follow-up the data suggests a decrease in motor behavior abnormality. بس بدنا 2 years يعني to start. Okay, here you can see the genes encoded and the vectors used uh, to target the dopaminergic cells and neurons. And here you can see the delivery route where they are injected whole viruses that can be injected in the stratium, subthalamic nucleus, or putamen. The references of the information discussed are present here. You can check them from the research articles, and thank you.